Thank you, Mr. Speaker. Thank you. I am pleased to rise so I may speak to Bill 3, the Opioid Damages and Healthcare Costs Recovery Amendment Act. One might think that during a toxic drug poisoning crisis that amounts to a public health emergency, that the government would take every action possible to save lives. But instead of passing legislation to, address wait times for treatment, expand opioid replacement therapies, improve health care for people who use drugs, or deliver on permanent supportive housing, instead we have a bill that is purely technical in nature. It's a housekeeping bill, and that's important. But Alberta and jurisdictions across this country are losing people at truly staggering rates. 6 people a day, Mr. Speaker, from January 1 to August 31st, 1,000 of this year, 1,262 Albertans have died as a result of a toxic drug supply. We are on track to surpassing a truly tragic record. So it's understandable that many, and perhaps even most Albertans, are asking us, their elected officials and healthcare providers, what we're doing about it. What are we doing to save lives? Because I've said it once and I will say it again, at the end of the day, if we're not doing all we can to save lives, then why are any of us here? But instead, Bill 3, the Opioid Damages and Healthcare Costs Recovery Amendment Act, amends a piece of existing legislation from 4 years ago to recover costs from a scenario that peaked more than a decade ago. I would argue that the current circumstances of the drug poisoning crisis has moved well past the subject of this bill. And though the bill is necessary, it will absolutely do nothing to help people suffering today. So, let's unpack what this bill will achieve and what it will not achieve. What does this bill do? It makes a largely technical amendment to a bill brought forth and that received royal assent in December of 2019. The bill was actually part of our party's campaign platform in 2019, and we had actually been discussing the merits of this even a year prior. It confirms alignment with legislation in British Columbia, the aim of which is for governments to recover costs for health care provided to patients that resulted from wrongful conduct of manufacturers, distributors, and their consultants. So I'll summarize that all for you. Back in 2018, 2019, the government of British Columbia decided to recover healthcare costs by beginning a class action lawsuit against the manufacturers, distributors, and consultants of opioids and many other prescribed medications. This legislation, the original legislation back in 2019, basically allowed for Alberta to join that class action lawsuit. Much as we had talked about as a caucus, and when we formed government in 2018, we thought we recognized the incredible damages that were being done by opioids and what had become a terribly misleading campaign launched by the manufacturers and distributors of that drug, and recognized that there was in fact a way to hold those manufacturers to account. It's really important to note that this act is in fact about the campaign. It's not about the molecules in question. It's about what ultimately was a deceptive marketing campaign. It misrepresented that opioids had a low risk of addiction, and I've lost my notes here, had a low risk of addiction, and that it did not have some of the truly fatal side effects that we came to see over 10, 15, 25 years ago when it first began. And so, in fact, this amendment allows for 2 class action lawsuits. And as I mentioned, it is almost entirely technical, and it is housekeeping. BC had the legislation. We passed our legislation. Now the federal government wanted to join this class action lawsuit, but now BC had to change their legislation again, and now we have to follow it once more. That should probably bring an end to these various amendments of this act, because there will be certification hearings in November and February of next year that verify that this is in fact a class action lawsuit that is legitimate and has grounds. It doesn't judge the merit of the case, but it does in fact confirm that we have met the threshold for this class action lawsuit. But as I mentioned, this does not address our current crisis. It does hold manufacturers to account. It does hold consultants to account, and that is incredibly important, but it does not address the nature of the current crisis. And so what we're seeing was an ultimately fatal campaign that downplayed the addictive qualities of their medication and the impact of a 2 decades long campaign that woefully understated the risks of OxyContin and oxycodone and others, that led to millions of lives lost or destroyed across Canada and the United States. It was an era of corporate greed, of lax regulation, and fraudulent practice that truly destroyed a generation, and it can never be allowed to happen again. And on that point, the Minister of Mental Health and Addiction and I agree. A couple of other points that I think are important to note. The class action excludes Purdue Pharma, which is perhaps a company that may come to mind in this conversation. The reason being that Purdue Pharma offered a $150 million settlement to British Columbia and to the class action prosecution, and they settled. And so Purdue is actually excluded from the manufacturer-distributor class action lawsuit. But I think it is important to note that the remaining defendants on that class action are not as big as Purdue, though there aren't specific numbers in terms of the estimates that may be recovered as a result of that class action. I worry that it will be woefully inadequate to in fact compensate governments and families and communities for the loss that these medications in fact inflicted. We supported this bill, as I mentioned, in 2019, and it was a part of our 2019 platform. But unfortunately, the impact on the current drug supply and the public health emergency that we are in will be very low, if not negligible. So that's what the class action, this is what the Amendment Act is, but I think it's important to discuss what it is not. Let's look at Bill 3, the Opioid Damages and Healthcare Costs Recovery Amendment Act. What it doesn't achieve, and in many cases with truly fatal consequences. 1, it does not enhance or expand current programming, such as drug testing kits, life-saving Narcan or naloxone kits. It doesn't expand existing programs such as the narcotic transition services or opioid agonist therapies or virtual opioid dependency programs, all programs that seem to me to be part of the spectrum of this government's highly touted Alberta recovery model. Because these are in fact programs that exist currently, albeit terribly limited, with incredible and kind of baffling barriers to access. On one point, actually, I want to mention that the virtual opioid dependency program and the drug overdose recovery system that allows for people to call in and have somebody on the line if they're using drugs by themselves requires cell phone coverage. There's big portions of our province that have very shoddy, if not zero, connectivity. What are those folks supposed to do? Unfortunately, given the limited data that is currently available, I think the uptake of those programs has been quite slim. The bill does not address the often immensely complex, concurrent, and compounding physical and mental health issues experienced by people with substance use disorders. It fails to address a toxic drug supply. This is really important, that has created what by any description would qualify as a public health emergency. Members in this chamber were sounding the alarm when 2 people a day were losing their lives. We're up to 6. And yet we still have a government that is refusing to recognize that their current approach is not working. And so I woe the fact that those numbers may very well continue to climb. It does not direct funds to evidence-based, proven harm reduction programs and services that save lives. It does not guarantee that the funds recovered will be used specifically and exclusively for treatment or detox. And contrary to the minister's opining last week, it absolutely does not suggest that we are entering a new opioid crisis as a result of prescribed opioid replacement therapies like methadone or hydromorphone. For the last 5.5 months, I have done a truly deep dive into my file, and it has been an absolute honor to meet with the frontline responders, with the people who use drugs, with the people who love those people, with the healthcare providers, with the academics and the decision makers that have this incredible decision-making influence, decision-making power and influence. And opioid replacement therapies save lives. And to villainize all prescribed opioids, as the minister has been inclined to do, misses the forest for the trees. What we have here is a lawsuit and an amendment act that allows for us to continue to participate in that lawsuit that was about a fraudulent marketing campaign that misled prescribers and the people who were prescribed those medications to believe that what they were taking was not addictive and it was okay. I'll repeat, this is not about the molecules of those substances. And to conflate the two means that we are denying critical life-saving treatments for people who so desperately need it. Targeting the prescriptions is dangerous. And we have seen currently with the narcotic transition services, for example, that the government has demonstrated really significant overreach into the practices and the prescribing protocols of healthcare providers that is in fact impeding their ability to do their jobs and to do no harm and to save lives. So 6 people a day, Mr. Speaker, good people use drugs. Bad drugs kill good people, and I want the needless loss of lives to stop. Each of those deaths were preventable. They are Indigenous folks dying at completely disproportionate rates. Members of reserves that are losing 10 people and more in a single weekend can hardly catch their breath for the grief. They are teenagers taking what they think is something pretty benign and dying alone in their family home on a weekday because what they took had trace amounts of fentanyl. They're tradespeople whose pain has become unbearable and they just want it to stop. And yes, they are the men and women that perhaps many members in this room are currently thinking of when they walk downtown or they're going to an event down at the Hyatt in Calgary, and they're folks who haven't got anywhere else to go. And they are wrestling with a brutal addiction, and they've lost everything. They've lost their jobs, their families, their health, their hope, and I don't want to lose any more of these people. But when we insist that recovery, whatever that means to this government, because I think there's some ambiguity in that, whatever that means is that when we say that recovery is the only answer, the losses will continue to mount. Every single one of these lives was worth saving. Albertans who use drugs deserve our care, consideration, and compassion. It is imperative that Albertans not be duped into believing that this government's response to the drug poisoning crisis is one of compassion, no matter how often they may refer to it as such. Because when you're offered an ultimatum, that's not compassion. It's unkind. And it's even cruel. And let me tell you what that ultimatum is. Currently, if you are someone struggling with substance use disorder, you can get support if you are repentant and want treatment. Anything else, and you have to jump through phenomenal hoops. You have to travel across town. You have to access space that may not always be accessible. And that is not compassion, Mr. Speaker. If a person doesn't access treatment voluntarily, they may be forced to access it instead.